Hello there, my name is KC Frank and I'm with Disc Corporation, and this is the Whiteboard Series. Today we're going to talk about when you should scan all of those charts as you go through your EMR implementation. This question is obviously a key one in planning out this project, and we of course have strategized and planned lots of these projects with our clients, so wanted to share our experience with you. Let's talk about when you should scan all these charts and what the different approaches typically are. So what we're really going to talk about are two different approaches on scanning these charts, when and how quickly you can get through this project. The first strategy is called batch scanning, and what batch scanning really is and feels like is like ripping off the Band-Aid. You get through it quickly, it's painful, but it's over in a hurry. And so for those of you that are comfortable with that approach, the batch scan is one you should consider. And what the batch scan really means is that you are going to very quickly scan all of your charts. So you will typically scan the majority of your charts, 90 to 95% of them, within a 30 to 45 day period prior to go live. So this period of time you're going to be really pushing through this project very quickly. Of course, if you're outsourcing, the batch scan is probably easier to deal with because organizations like ours can scan millions of documents in a very short period of time. But you're going to scan the majority of your charts 30 to 45 days prior to go live. There will be a small cleanup project post go live. Those are usually the charts for patients who are scheduled to visit during that 30 to 45 day window when you're doing all of the batch scanning. So for those patients, you typically push their scanning off until after you've gone live, and so there's a small cleanup, but generally speaking 90-95% of your charts get scanned prior to go live, which means you're preloaded in your EHR, your EMR system with all of your charts, which is really nice. If you can go this route, this is a route that it is like ripping off a Band-Aid, but it's wonderful to go live with all those charts in the system. And typically most of the time these batch conversion projects last about 2 months. Now, looking at the other side of things and what we call a scan by the schedule, what this really means is that you're looking at your schedule and you're scanning the patient records as they visit. So you're either going to put a process in place to scan just before their visit so that when they visit for the first time after you go live, you're already scanned, or you're going to scan their record just shortly after their first visit. So you have to make that decision. Once you make that decision, you go right into the project. Now, how full is your schedule? It's an important question if you're going to scan by the schedule, because if your schedule is not that full, if you leave a big portion of your schedule open, then you're probably going to want to augment your scanning with some other scanning, most notably probably going through the alphabet to accelerate this project. And what we mean by that is you may combine the pre or post visit scanning with going through the alphabet A through Z and scanning those patient records. If you've got a light schedule and you keep it open on purpose, then the project could last a very, very long time if you don't accelerate it with an alpha scan. And scan by the schedule typically takes 3 to 6 months or so. I've actually seen some organizations that did their own scan by the schedule that took 12 months to 24 months. You can accelerate it as much as you want or as much as you can bear. So those are the two approaches that we see most often. Hopefully you learned something about this today. Again, this is KC Frank. I am with Disc Corporation, and this is the Whiteboard Series. Have a great day.